So, welcome to Project Echo. I'm Lindsay Zimmerman, and we will go ahead and move forward. We probably will have some participants trickle in, but hopefully they'll join in time to hear the discussion today. So, we are going to have a presentation from one of Tennessee's Department of Health's nurse practitioners, Terry Hooper. She is going to be discussing hepatitis C treatment via telehealth. This is a process that TDH has started. She's been treating via telehealth for quite some time now, several months, and we're hopeful that we can expand this option across the state, but also external providers to have the opportunity to learn more about doing hepatitis C treatment via telehealth. We will have a couple of case presentations and then an opportunity for some Q&A at the end. As always, to participate in Project Echo, it is not a requirement to receive the continuing education credit. However, if you are interested in receiving the credit, please make sure that you register through the Southeast AIDS Education and Training Center. In order to receive that credit, you do have to set up a profile and register. Once you attend the full session, you will receive a post-session evaluation, and then your certificate will be emailed at a later time. Kimber has dropped the link in the chat, but you can also use the QR code on the screen. So just a few introductions and announcements. Please take the opportunity to put your name and your organization and role in the chat. You can also include if this is your first Echo session. If you do have any technical issues during today's session, please make sure that you reach out to Kimber Miller. She has put her information in the chat, so please make sure that you do reach out to her. We'll just take a moment for the folks to be able to do this, as I do see that we still have some people joining. I do also want to mention, although our Project Echo is run out of the Tennessee Department of Health, we do want to expand out into the community. So it's not, participants are not just from TDH. We encourage all providers or staff that are interested in learning more about hepatitis C treatment or participating in treating patients living with hepatitis C to please join. So make sure that you do share the information, as it is community driven. All right, next slide, please. So we started this process last session, and I hope that we will have some good discussion today. But before we actually get into the session, I want to take an opportunity to have just a couple of little icebreakers. And so please make sure that you participate in the chat, or you can even come off of mute. Either is welcome. But right off the bat, if you could be on any game show, which one would you choose? I'll go ahead and tell you. I don't remember the name of it, but the one where you had the shopping cart and like they would give you a list and you had to find everything within so many minutes. I could win that at Walmart, but only if it's my local Walmart. I can't do it anywhere else. I got to catch up in the chat. Okay, Price is Right. Absolutely. That one is hilarious. I always think that I'm really going to win big money sitting in front of that TV, spinning that wheel. Oh, it's the grocery games. Yes. Yes. New appliances. Exactly, Melissa. That's a big deal. Family Feud? Yes. Love Steve Harvey. Wheel of Fortune? I always, again, think that I'm really going to win big money spinning that wheel, but I know I would get bankrupt every time. Remind me, Kimberly, which one was Let's Make a Deal? I'm not old enough. I feel like I've heard of it, but I can't remember what it is. I may have watched it when I was little. All right, so these are great. Oh, they would pick a curtain and prizes were behind the curtain. Everyone dresses in a costume. That sounds hilarious. Okay, we'll go ahead and we'll go to the next one. We're going to change it up a little bit. What is your go-to coffee order? If you don't like coffee, that's fine. Put whatever is your go-to drink. Dr. Alfaro Cruz, I love it. There's a lot of healthy people in here. Mocha more sugar than junk than coffee. I love pumpkin spice. I'm one of those people. Yes, Stephanie. Absolutely. You're speaking my language right there. I don't think, Claudia, that I have ever tried green tea. I've heard that it has a lot of good like health properties, but I don't think I've ever tried it. Oh, yes, Sherry, you can get a pump of brown sugar. You can get a pump of anything. You can get vanilla, you can get uh literally anything. You need to try that next time you go. These are all good. All right, so we'll go ahead and go to the next one. Oh gosh, that sounds amazing. That maple bourbon. Oh, that sounds delicious. Okay, so aside from your current job, what is your ultimate dream job? Retired. Absolutely, Dr. Alfaro Cruz. I tell my husband that one on a regular basis. Exactly, Kimber. Yes. Yes. Oh, I love that, Dana. I think mine would be either something with animals. I don't know if maybe like a zookeeper. I thought a veterinarian for a while, but I don't know. Um, but I also love plants, so I would love to own a greenhouse. Forensic pathologist and medical examiner. I always had interest in that, but then the thought of working with children bothered me a little bit. A midwife, yes. Yes. I love it, Terry. And a stay-at-home mom, absolutely. More about natural medicine. I agree. I think it's a very interesting area. All right, so these are great, and I appreciate y'all participating. It's been fun to read some of these. So we'll go ahead and we'll get started with our actual session today. For those of you all that joined midway through, our session today is going to be presented by one of the Tennessee Department of Health's nurse practitioners, Terry Hooper. She works out of our East region in the state, and she's going to be discussing hepatitis C treatment via telehealth. This is something that we recently started over the last few months, and she's had great success with it. So we wanted her to take the opportunity to present today. So, Terry, I'm going to go ahead and turn it over to you.
Thank you, Lindsay. As Lindsay said, my name is Terry Hooper. I am a nurse practitioner. I work in the East region, and today I will be talking to you guys about hepatitis C treatment via telehealth. I have no financial disclosures. So, the objectives for today are to identify the benefits of telehealth appointments, understand the process of hepatitis C treatment via telehealth, determine who is eligible for telehealth visits, and identify what platforms can be used to conduct a telehealth visit. So this is just a list of the abbreviated terms that I will be using today. You can go into the next slide. So just an overview of hepatitis C. It is a liver disease caused by hepatitis C virus. Left untreated, it can cause advanced liver disease, liver cancer, and even death. Hepatitis C is curable in more than 95% of cases. However, about only 1 in 3 people with hepatitis C and insurance receive treatment within a year of diagnosis. So just imagine how much higher that number is in people that are uninsured. So the benefits of telehealth are the convenience for patients. They can do this out of their home, they can do it at work during their break, or they can do it in between running errands. It does provide extended access to care. It offers flexibility for patients. It helps patients who have transportation issues, and it also reduces travel time and expenses for patients. Hepatitis C treatment via telehealth is very easy. It's the same pre-workup as if the patient would be seen in the clinic. It doesn't differ much from an in-person exam aside from not being able to complete a comprehensive physical exam. If you suspect that a patient needs to come in for further assessment, you can always have them come into the clinic. The process for a telehealth visit: if a patient presents for a nurse visit and reports a history of positive hepatitis C tests and desires treatment, the PHN should proceed with drawing the pre-treatment labs as indicated in the public health nurse protocol. This will improve access to and the efficiency of HCV treatment, and then all the results should be sent to the county's treating provider so they can review it. If a patient does not have a documented RNA, the nurse can collect pre-treatment labs with a provider order. It's important that patients know when they come in that there is a possibility of HCV treatment not being indicated if natural clearance has occurred. So the process for a telehealth visit will begin with the public health nurse. They will draw pre-treatment labs. They will update the medication list. If the patient is uninsured, patient will complete the patient assistant form while in the clinic. There's several different forms that can be used, and that will depend on the patient, their preference, and medications that they are taking. If the patient isn't insured, an ROI will need to be completed so we can communicate with a specialty pharmacy. And before the patient leaves, you want to have them go ahead and schedule their appointment with the telehealth with the provider before leaving the clinic. And you want to make sure this is 2 weeks out to make sure that you have time to receive and review the labs. So this is a list of the labs needed prior to a telehealth appointment. One thing that is not on this list is a genotype. Most insurance companies do require that prior to treatment. So if the patient has insurance, then I would go ahead and get a oh, it is on there, sorry. And so if they have insurance, just make sure you get that genotype. So prior to the visit with the provider will need to review the labs and determine eligibility for treatment. You do this by using the simplified treatment algorithm, and that is outlined below. If the patient is eligible for treatment, you need to review the current medications. It's important to check medication interactions prior to deciding which treatment regimen is best for the patient, and you can do that on the website listed below. So conducting the telehealth visit, you can do a limited exam through the telehealth. You can assess their skin, their eyes, discuss the treatment options with the patient and decide the best option for them. Counsel patient on medication administration, side effects, and the importance of med compliance. The patient should report any side effects, missed doses, and medication changes immediately, and advise the patient not to start any new prescription or over-the-counter medications without approval by the provider. Stomach acid medications should be approved. After starting treatment at 2 to 4 weeks, you want to follow up with the patient. You want to confirm that they receive their medication and they're taking the medication as directed. Address any patient concerns and then re-counsel them on preventing the spread and the chance of reinfection. And it's also important to know at the 4 week mark, you want to encourage them to change anything that could be contaminated with blood. So that would be toothbrushes, razors, fingernail clippers, anything like that. At 8 weeks, if the patient is taking Epclusa, you'll just do a follow-up as needed, confirm that they're still taking their medication, no missed doses. And then if the patient is taking Mavorit at 8 weeks, they should have completed that. So you want to confirm the completion date and then remind them to return to the clinic in 12 weeks for an SVR. At 12 weeks, if the patient is taking Epclusa, you want to confirm that they completed their medication, document that date, and then remind them 12 weeks from that date they will need to come into the clinic for an SVR. So, who is eligible for a telehealth visit? Every person, every patient desiring hepatitis C treatment is eligible for a telehealth visit if they have access to audio-visual technology and adequate cell or internet service. There's different platforms that can be used. The one that I mostly use is doxy.me. It's more user and patient friendly. Patients make an appointment before leaving the clinic and they get a paper with my doxy.me link and a QR code that will take them directly there. It's important to note that this platform cannot be used to provide telehealth visits on minors. Teams can be used, but the patient must download the app prior to their appointment. Usually patients get frustrated with this and it's not their first option because they don't like having to wait to download the app and they usually don't know that they have to download it until they go to click the link and then they're prompted to download that. Other platforms that can be used is Zoom, Teledoc, and WebEx. Does anybody have any questions?
All right. Well, if there's no questions, oh, okay. So there's someone in the chat that's definitely, they are with TDH as well, but they have wanted to add in that they've discussed exploring this option in their region. And so that's exactly why we wanted to present this is again, although Terry is internal with TDH, as I mentioned in the beginning, we want this opportunity with Project Echo to be community driven. So although this is something that we have implemented across our state, we want you to know that you can also take advantage of this opportunity externally as well. And so if your clinic is interested in this process, again, please feel free to reach out and we can connect you with providers that have been successful in treating patients via telehealth and help you navigate that process. Does
Yes.
anyone? Oh, go ahead,
Sorry.
Terry. No, go
I was
ahead.
just going to add, if anybody wants to, email me or contact me, if they have any questions, I can always help them.
Dr. Chastain, I see your hand raised.
Thanks so much, Terry. That was a great overview as far as a tool. I was just wondering if you might comment, what's your experience been like as far as doing it with patients, and what do you feel like you've gained, and what do you feel like you've missed?
So I feel like the patients really like it because a lot of our patients, it's hard for them to come into the clinic. And so when we let them know, hey, we can go ahead and get your blood today, do all that stuff, and then we can get you a telehealth appointment with a provider, most of them are on board. And so they're very eager to do that. And then, um, I mean, they seem to enjoy it. I think the only setback is you can't do that comprehensive exam, but really, most patients don't need that. And if you feel like they are one that does need it, you can always request that they come into the clinic and you can do a comprehensive overview of them.
Yeah, I would agree that like my experience with doing telehealth for viral hepatitis appointments is that for patients who have any barrier, doing a telehealth appointment is far superior to those barriers keeping them out of care. I don't feel like you lose a lot. And there are things that definitely are preferable from a patient's perspective. I think one of the most common challenges that we've run into is co-located uh, lab uh, appointments along with in-person appointments because it sounds like you all have worked around that as far as collecting a lot of the data as part of the entrance into the appointment. I think that for some of my folks who struggle with transportation or other challenges, when they're in person, I kind of have a bird in hand, so to speak. And so I'm able to get labs, evaluation, do all of that at one time. And then I found that that is helpful. And then to those folks who are able to engage with telehealth, that's great. And then, yeah, there's still sometimes some of the logistical challenges. And so I would echo all the things that you said. That's what I think it's a fantastic option. I do want to highlight for folks if you're working in your own clinical practice or if you're working with a different organization, there might be stipulations regarding what is allowed for billing, coding, and or for patient privacy and the context about what platform you should use. So if you're working with your own organization or institution, you should just ensure that you're following those protocols accordingly.
Yes, thank you, Dr. Chastain, for mentioning the privacy, because that is something that does have to be reviewed prior to doing telehealth as well, and also the billing aspect as well. We didn't dive too much into the billing aspect for today's session, just because billing overall we know is going to be very similar. However, people's involvement, depending upon their organization and agency, may be slightly different. So, if you have specific questions about that, please feel free to reach out. Does anyone that's participating today, besides Dr. Chastain and Terry, have any personal experience in treating that you would like to come off mute and discuss that?
I also have some experience treating hepatitis C, both in person and via telehealth. And I think there was a lot of initial hesitancy when we started doing this because there's like, oh my gosh, but how am I going to know? But I think it becomes pretty readily apparent most times when you're talking to your patient or either when you get those labs back that, oh, there may be something else going on here. Or they may have a history of something that, okay, I really need to bring them in and do that physical exam. But like Terry said, most of our hepatitis C patients are young and healthy, and generally they just need treatment. And so it's been a really good way to kind of meet them where they're at and just get them taken care of. Not to mention Annie, our case manager, is fabulous. And so like we do that first visit, we order a med, and then she takes it from there, and she takes all of that. I mean, she argues with their insurance and gets the paperwork done and all of those things that we don't really, love dealing with. So she is fabulous, and I mean, I don't know that we would be doing as much as we're doing if it weren't for her. So thank you to Annie, and good job, Terry. You did great.
Thank you, Dana. And as we already mentioned too, if there's anyone that's interested in exploring this option, please don't hesitate to reach out. Even if you are an agency that's external of to the Department of Health, as we can definitely connect you and get you resources, as the biggest thing is we just really want to expand the opportunity for patients to have access to care.